Section 1. Referrals and Pathway.
Meeting centres typically don't insist on members having a formal diagnosis. Nevertheless, members will be dealing with local health and social care services, whether seeing their GP, visiting a memory clinic, speaking to a dementia advisor, or getting support at home. Such services can refer people to meeting centres and can also work with them beyond simply referring, so strong collaboration with professionals in the health and social care pathway is key to sustaining high-quality meeting centres. The health and social care system is made up of lots of different people and services from different organisations. This can be bewilderingly complex. Clarity and good communication is needed to ensure people in the system remain aware of meeting centres, who is responsible for referring and how and when to refer. Health and social care professionals need to know what meeting centres aim to do and for whom. If professionals understand that, then they may see the benefit of meeting centres for their own patients or service users. Third sector organisations, such as regional or national charities, can also have a role to play, whether acting as referrers themselves or helping forge links between health and social care services and community support such as meeting centres. We have the following recommendations. We suggest meeting centres create clear, appealing and inclusive promotional materials. This needs to include what a meeting centre is, who it is for, and how it differs from other forms of dementia support. Promote these materials widely to professionals working in the dementia care pathway. Ensure someone at the meeting centre is responsible for understanding which professionals and services might be best to contact regarding referrals and support. Ensure someone has the time to regularly liaise with health and social care services and work with other third sector or community linking services who might help refer people. We suggest health and social care professionals ensure information on community support like meeting centres is kept up to date and make use of third sector partners that can connect patients or service users to that support. Ensure the dementia care pathway is well understood and clearly communicated between colleagues, external partners and patients or service users. Share information provided by meeting centres widely with people living with dementia in the community and those that support them. And ensure the meeting centre offer and how it differs from other forms of dementia support is clearly understood and articulated to people. Dementia is underdiagnosed by clinicians and underreported by people and families, especially in the earlier stages. People may not want to seek a diagnosis or find it difficult getting diagnosed. This may be due to stigma, denial, or worries about practical repercussions or difficulties accessing health services. Whatever the reason, if people don't seek a diagnosis, they are much less likely to hear about or want to attend a meeting centre. We have the following recommendations. We suggest meeting centres work in their communities to challenge stigma, promote dementia awareness, the benefits of an early diagnosis and support available, and offer to help people engage with health services and get a diagnosis where appropriate. We suggest health and social care professionals continue to work to overcome barriers to diagnosis, including raising awareness of dementia, the benefits of an early diagnosis and support available, and continue to work to reach people who are more isolated. Meeting centres are for people with mild to moderate dementia. As a person's dementia progresses, a meeting centre may not be able to meet their needs any longer, so they'll need support from another part of the care pathway. If there's not much appealing or appropriate support available for people to move on to, they might not want to stop coming to the meeting centre. Staff might feel like they can't let them go, meaning more people with advanced dementia will end up staying on at a meeting centre. We have the following recommendations. We suggest meeting centres should ensure professionals know what a meeting centre can and can't offer, when it can meet people's needs and when they will need other forms of support. Liaise with professionals in the care pathway regarding what is available for members moving on, what their needs are and where the gap is. We suggest health and social care professionals ensure there is adequate support available for those whose needs can no longer be met by a meeting centre and that everyone knows about it and how to access it. You can also watch our videos on external relationships and collaboration and reaching people and membership.
This independent research was funded by the National Institute for Health and Care Research, or NIHR, under its Research for Patient Benefit Research for Social Care programme. Grant reference number NIHR 201861. The views expressed are those of the authors and not necessarily those of the NIHR or the Department of Health and Social Care. We would like to acknowledge and thank all Meeting Centre attendees, personnel and partners that participated in this study, as well as our research collaborators at the Three Nations Working Group on Dementia, Nuffield Department of Primary Healthcare Sciences at the University of Oxford, London School of Economics and Political Science, and Worcestershire County Council.